Good morning, everyone. We're going to get started. So I will just go through a few logistical things again because we have some new faces today. So as a reminder, restrooms are out past the registration, around where the elevators are. We have a little bit of a longer morning program this morning. Again, we have a break in the morning, but we will have lunch today at 1 p.m. And we have our programs today as well. So if you have not received them, they're also at the registration table. And then finally, we have some surveys out on the tables for you to fill out at your leisure, just to get some feedback on the sessions and how the conference is going. No obligation, but we would love to get some feedback from you. So let's go ahead and get started. I'm going to welcome Mel Spigelman from TB Alliance to the stage.
Good morning, and welcome to everybody, and thanks for coming back. I was also instructed, so we've all been given our instructions, everybody during the break, if you haven't gotten the booklet that finally came from the printers, please go out and pick one up on the counter. And they, I had a chance to take a look at it, and it really has some great summaries in it about a lot of the things that have been going on. So just to leave everyone, sort of with written material too. So it is worth picking it up and using it. So I just wanted to briefly sort of set the stage for today in terms of what the expectations are, and hopefully what we'll be getting out of the day's summary. Yesterday, I think we had a really great almost sort of insights into what's coming. What are the tools that look like they're around the bend or in the horizon that could be usable in terms of drug development, regimen development as we look forward and as we move down the road. And obviously that's in addition to Radha. I don't know if Radha's still here or maybe she, but Radha's tour de force on the meta-analysis or the combination analysis of the quinolone trials. And I think that's also, really instructive, if not for what the studies themselves show, but what can be done if we now proactively, because that was clearly one of the problems, I think, in putting those three studies together, is they weren't planned to be put together when they were first formulated. This was really a post hoc type of attempt to see what could be learned by putting them together. But if we can really get into the mindset of really much closer coordination on the large-scale clinical trials, which unfortunately we still don't have that many within the TB world, but if we can begin to collaborate much more proactively in terms of putting those together, I think that would certainly yield a lot more fruitful results when, in fact, we then put the results together and learn from a much greater number of patients from much wider studies. So that I think is probably maybe even a bigger lesson than, the 10 million charts with all the summary data that we saw yesterday, is how can we even do that better next time around. I think there was certainly a lot of really interesting thinking around what are the tools that we'll have to work with in the future in TB. Today is a much more varied day, and when we put the program together today, for today. So first of all, I think one of the real second legs of the CPTR initiative you will see in full force today, and that's when we look at how are the major clinical programs from almost all of the sponsors of especially later stage clinical trials, how are those going, and what are the results of those, and what progress has been made. And so that's always, I think, a really interesting piece, because obviously at the end of the day, that's what we're really shooting for, is to get as many of these regimens into clinical trial and actually to see how they work. So clearly we're going to, hear, I think, in a lot of interesting stuff related to the clinical work. We're also going to build on where we left off yesterday and also look into some concepts of how we can also bring up better tools for further development. And we will have, for the first time on this meeting, some breakout sessions. And we will transition into kind of the third leg almost of CPTR, or maybe it's the fourth now, with the diagnostics. So we'll start and kick off the diagnostics work this afternoon. But I think maybe for me one of the most exciting parts for today is really the morning session that we're going to get started now. And so first of all, and Martha and Deborah will introduce, we're really fortunate and really want to be thankful for the FDA's participation, and Ed Cox and Rick Pastor will be here to really, I think, give us some firsthand real insights from the FDA on really what not only is going on in the area of antibiotics or antimicrobial regulatory science and regulatory work, but I think to go much deeper and to look at how does this compare, and what we've done today, and really want to thank participants, is begin to balance that or to begin to learn off of the other area where combination work is really critical these days, and that's oncology, or one of the other areas. But I think the real I think the real highlight and most important part of the day is really the second session, and I really want to thank the TB patient participants, and we're really fortunate to have two patients who have made it through TB therapy here to share their experiences with us. This is an area that, at least for me, and I think for a lot of us, that it's easy to get too far removed from really seeing what the problem is that we're trying to help solve. And I think having a reminder, and there can't be enough of them, of what really is the issue on a personal level of what is it that we're really trying to accomplish together in the area of TB. That, I think, is maybe the most critical piece of what we'll be doing here over these 3.5 days, is really having that reminder. So I really want to thank both of our representatives for making the long trek, for coming here and being willing to share their experiences with the group. So with that, I'm going to turn it over, I think, to Martha so that we can actually get started with what we've got on the exciting parts of today. Thank you.